And so let us just focus on one more time on the criteria. And Zaina, you say that there are 4 students in your group using.
But one of them is absent.
Mohammad Viam?
Yes.
Is Mohammad Viam here?
He's not.
He's not. So did he really take part in the presentation preparation?
Yes, he did, but I think he's having some internet problems.
I would rather listen to him. And Tala is here and Sadin, right?
Yes.
Yeah.
Okay. Okay, just 3 of you, and I can. So we can do like just a minute. So you may share the screen now. Start, please.
Okay. Can you see?
Yes.
So today, hello everyone. Today my group and I will be talking about the patient-centered approach. And it's done by Zaina, Muhammad, Tala, and Sabine. Okay, so I'll start off by explaining what is the patient-centered approach. Of course, when we talk about patient-centered approach, we're talking about the patient who is receiving the healthcare. And in this case, the healthcare provider must treat his patients or her patients with dignity, must be trustworthy, and must show them all respect, and also must involve them with all decisions. For example, update them when it's necessary. The patients must know what do they have to expect, what are the treatments that they're going to get, and everything related to this. So they just must be included in everything related to their health. And this type of care is also known as the person-centered care, because this approach is all linked to the person's healthcare rights. Now, the goal behind this patient-centered approach is to just motivate the patients and empower them to care about their health, to know more about it, and to be active participants in their care. And this, of course, requires the healthcare providers, whether they were doctors, psychologists, or so on, to have good communication skills with their patients and also to address them in a very effective way and very efficient as well. And also the healthcare providers, they must provide care that is not only effective, but they have to make sure that's also safe. And when speaking of patient-centered care, the driving force is basically the individual's specific health needs and also the desired health outcomes to make sure that the outcomes behind all these treatments is going to be positive. And patients, of course, are partners with their healthcare providers. And also the most important point that the healthcare providers shouldn't only treat or look at their patients from the clinical perspective. For example, sometimes the patients might need some mental support or emotional support. So this is why they need to look at them from the emotional perspective, mental, sometimes spiritual, when they have to make sure that their patients are optimistic, as well as social and financial perspective. Okay, now Sadine will talk about the principles.
Now we're talking about the principles of the patient-centered approach. So the first one is the respect for the patient's preferences. So during the treatment, the patient should receive all the needed information to allow them to take the decision about their healthcare according to their preference. So those preferences should always be considered by determining the best course of action for the help of the patient. Number two is emotional support. We know that the emotions play a very important role in the healing process. So if the patient is feeling good, if their emotion is good, the process is going to heal in a much more faster way. Practicing patient-centered care means recognizing the patient as a whole person, having multidimensional human experiences, eager for knowledge and human connection, who may need sometimes extra specialized help in keeping up the spirit of the optimism. So advanced level of the emotion can, for example, include sitting with the patient, providing opportunities for them to feel accompanied in their struggles, directly answering their questions, and making the patient feel special. Number three is involvement of family and friends. The patient-centered care encourages keeping patients involved and integrated with their families and their communities. The patient must feel that they are still part of the community, they're not isolated. They should have their family and friends with them so they can provide them with support. For example, sometimes the family can provide more support than the friends, therefore they have to stay involved with them. Number four is the continuity and the transition. A transition from one phase of care to the next should be as fluid and seamless as possible. Patients should be well informed about what to expect. The treatment regimens, especially medications, should be clearly outlined and understood. Also, everyone involved should be able to plan and understand what warning signs to look out for.
Okay, and now Thala will talk about this diagram.
Okay, I will talking about the patient-centered care. About the first one is the mission values aligned and with a patient goals. It will be like about the example about safe for a patient and participation of the local community and achievement it needs and achieve. And to this, it's about the killer operative and coordinate and experts. It's like how this is care of patients must be coordinated to ensure his recovery and coordination with him to make it easier. And the first one, the physical comfort information will be about the priorities. It's about the one of the most important, it's immediate priorities of the patient and maintain the patient's mental health and physical comfort to avoid any risk. And the fourth one, it's about the patient family viewpoint and the reverse of the polio. It's how to like listen to understand, and the doctor will best me keep promise and be encouraged and connect with the other patient and access correlated and the share information. And about the patient family always included and discussion, it will be provide valuable information about the patient function at home and not be worried about that are any information are hidden of something, to be not worry about the patient. And the family will come in care setting. And finally, it will be full transcription and first delivery. It's about the information. It will be to got it in community transcription and clear and there posted it and the portrait of headache or portrait something or poor business practice. And now we're talking about patient of centered care. It's about the primary, it's the core benefit. It will be like to get good care despite and the ease of the dealing with it. And the patient of services improving, that will be, it's about the health care of experience and the purchase and outcome. And orthic population, its outcome made process approved by the patient and will be, it's about the health care and service and about the patient benefits. But it will be provided and healthcare system a benefit as well throughout.
So as Tali mentioned, that for the benefits of patient-centered care is that what this approach cares about is the individual and not just the population, because we can see that they're both directly proportional. If the individual had positive health outcomes, then the population as a whole will also have positive health care outcomes. But what they mainly care about is the individual. And also some of the benefits that healthcare providers might get from this approach is improved satisfaction scores among patients and their families, enhanced reputation of providers among healthcare consumers, and also better morale and productivity among clinicians. Okay, and this is an example of the patient-centered approach. One of the examples is in the doctor's office. So of course, when speaking of the doctor, we have to know that the doctor must treat their patients in a very close and very like full of truth and reality between them. The patients must feel like they're in a safe place, they must trust their doctors, and they must have some like personal relationships with their doctors. And most important thing is to include empathy and two-way communication. The doctor must have communication skills and the patient must accept what the doctor is saying and respond back. And also, important thing is eye-to-eye contact, so that the patient can feel like the doctor actually cares about making them feel better. And also, the doctor must have the ability to see beyond the patient's immediate symptoms and pain. And this broader look at the needs of the whole patient, it requires the healthcare providers to offer some services. As I mentioned before, sometimes they might need some mental and emotional support. Sometimes they might need some financial counselors or transportation and daily life assistance. And this is the second example.
Yes. Another example is the patient-centered care in the hospital. So the strict visiting hours and visitor restriction are a thing of the past. However, now the patient has the right to identify who can visit and when. For example, some patients prefer their visits during the early day, for example, at the morning. Others prefer the afternoon. So it's now up to them to take their decision. Family members are invited to visit during the rounding and shift changes, so they can also be a part of the care team, participating in the discussion and other care decisions. Other examples can also include help in making the schedule for the patient's sleeping and waking time according to the time where they feel most productive. As I said, some patients can be productive more in the morning, other can be in the afternoon. And another example is help the patient decide what to wear on a specific day according to their preference.
Okay, and we're done. Thank you for listening.
Well, okay. So thank you. Thank you, Liz. And so if we go back to yes, to this criteria. And so I would like someone to say some words of the presentation to evaluate.
Yes, doctor.
So is it Abdelrahman?
Yeah.
Okay, so please.
Doctor, I think it's a perfect presentation, and also the way of presented, it's beautiful. And I think also the presentation was full of good information about patient approach and patient healthcare center, I think. And all of the members did perfect work, yeah. I think that.
Okay, yes. Okay, thank you. I agree that it was very just informative, and there were just so there were some examples so that you found to illustrate the ideas that you presented, and so it was divided, the information was divided into chunks, and just as for organization, all parts of the presentation just followed each other in a logical way. So, and you've also used the diagram to illustrate this the patient-centered approach, and you commented on the diagram, and you were, I see that all of you were speaking, not reading, and I like how your just the text is organized, but I would recommend to use more illustrations and to involve the eyesight. And so, but the material that you found is great, and the the way you've presented it is rather professional. Thank you so much. Well, and well, the group which prepared the presentation about Calgary-Cambridge method, Ahmad,
Yes,
Mohammed
Ahmed
Nabil, and
Nabil.
Manzil Hussein. Manzil is absent, yes?
Yes, unfortunately.
And there are only two of you. Did Manzil participate in the preparation of the presentation?
Actually, he is planning to leave the university. So
Sorry, what? Will you repeat, please?
I said actually he's planning for leaving the university.
Ah, really?
Yes. Yes.
Hmm. And is he in his country?
Yes.
He has to come here. Okay. So he's planning to leave.
He's just planning. There is no sure information. So yeah.
So it means that we shouldn't expect him to come. And yes, it doesn't make sense to evaluate his participation. And mhm. Okay, so there are two of you, Ahmad and Mohammed Nabil, and now you may share the presentation.
Yes, I will. So can you see my screen?
We can see. Mhm.
You can't.
I can see. Yes.
So, hold on a minute, please. Yes. Patient comfort while treating. One of the important things to be a successful doctor and to make your patient know that they are in the right hands is the knowledge and application of how to communicate with them. So now the question is, what methods and rule that you should follow? But before I go, I would like to tell you how important to make your patient comfort, which improves health outcomes. And if the patient are comfortable, they are likely to recover quickly and have better health outcomes. So, for sure, we need a method to apply this comfort and well treating, which is one of the best methods, the Calgary-Cambridge method. So let's have the opportunity to develop our skills in managing difficult patient encounters where there are strong emotions and stressed families or uncomfortable conversations. So what is Calgary-Cambridge method? It is defining the communication curriculum and to develop a feasible teaching and training clinical communication methods. Currently, it is used worldwide and was last updated with a third edition in 2013. The CCG was not intended to be an assessment tool. However, during teaching sessions, it has been used as a guide to access the specific communication skills performed and to provide systemic and structured feedback. The conclusion, this method aiming to study and to conform the reality of observation and rating clinical communication skills. So, Nabil, here you go.
Yeah, now, what is Calgary-Cambridge consultation model? The Calgary-Cambridge model will walk you through each aspect of the session for the most effective time management and information gathering. This course focuses on the final stage of the session, how to close the session, and is the last course in the communication and the medical interview program. The Calgary-Cambridge guides. The Calgary-Cambridge guides were developed to delineate effective physician-patient communication skills and provide an evidence-based structure for the analysis and teaching of these skills in the medical interviews. This model offers a practical, integrated method of teaching both the communication process and the effective acquisition of content information. It emphasizes the importance of patient-centered medicine, such as relationship building and shared decision-making. The model has served as a foundation for many medical interviews and continues to guide clinicians in all fields of medicine. The Calgary-Cambridge model is presented in 3 diagrams, which aids to enhance communication skills training visually and conceptually. The first diagram summarizes the medical interview as sequential 5-step process. We'll start with initiation of the session, gathering information, physical examination, explanation and planning, and closing the session. Second diagram provides more details and achievable evidence-based objectives in each of the steps in the medical interview. The last diagram shows the interrelationship between content and processes, using the example of the gathering of information. Yeah.
So here's a video to show you the method related to the history taking information.
I can't hear the voices. Can you hear?
No.
Actually, I do, but I don't know about you. Can you guys?
I don't hear.
Actually,
Okay, so that's it. Thank you for listening. And yes,
Mhm.
thank you.
Maybe you can do something. I'm not just the expert in technician. Well, in my in the instruments here, there is the tick, which is the access to the sound. Maybe you. So.
To be honest, I don't know how to make access sound.
I see. Okay. Okay. Thank you. Well, so the gentlemen have finished their presentation. Who would like to say something about the presentation?
Can I, Doctor?
Your name?
Khalil Mahmoud.
Khalil, please.
I think the presentation was very good, despite the lack of students who presented. It was a good and interesting presentation.
Mhm.
And I think everyone benefited and learning about the Calgary-Cambridge method. And the way of presenting was also professional, and they did it on the right way. And I also liked how they provide the video for improving the notes. It was a very interesting presentation.
Mm. Okay, thank you for your opinion. Does anyone else want to say something? No. Okay, so well, what I liked in your presentation, I liked how Ahmad used the introductory leading in question to start the presentation. Just it was interesting. And you have really attractive and spellbinding voice, Ahmad. It's just very pleasant to listen to you. I mean, both of you. Mohammad Nabil, your voice is also very attractive, and it was like listening to some professional actors giving a presentation. And you should use it in your future medical practice. Well, and you should know about the impact of your voice. And my recommendation is to divide the text into smaller parts because on some slides, so too much text, and so it's like too much text normally it scares the audience. When they see too much text, they don't know what to do. And you should use the bigger font, the bigger letters, just to make it more visible, so the audience can feel more comfortable just reading, following what you are speaking about. And surprise, surprise, where are the diagrams? You were speaking about some diagrams, the first one, the last one. Where are they? I didn't see them on the slide. What did you mean, Mohamed? Which diagrams were you speaking about? Mohamed? Hello? Are you here? Maybe Ahmad can answer this question. Well, no reply. Are you here, guys?
Yes.
I mean,
Yes,
Ahmad, you should just, if you speak about the diagrams, you should show us the diagrams. So maybe you can see them somewhere, but we don't. That is why I don't.
Actually,
Yes?
yeah, I would put it in the.
Sorry? Yes? The connection is bad. The connection is bad. I can't hear you. Well, I see that you are just try to tell us something, but I can't. So
But I didn't know how to. I didn't know how to put it in the.
you didn't know. This is. I mean, if you don't know something, this is a good chance, to start. Just to start learning something. Just. Yes, there is a message. How to put it in. Okay, if you don't know how to put it, don't tell us about this. So we feel like disappointed. Well, okay, anyway, so we've listened to everyone, almost everyone, yes, in your group, and I'll just put the on your site later this week, okay? Your points for the presentation. And so let us just we have yes some time, and I would like to. So to make the slide bigger and to yes like this. No, this one. And let us move to the slide with the pictures. Can you see the slide?
Yes.
Working in general practice. Yes. Full screen, right?
Yeah. Yeah. Full screen.
Yes.
Okay. So here you can see 4 pictures illustrating different medical jobs. We are going to speak about working in general practice, and you can see the pictures and the job titles, and so actually we can match them. And the question, can you predict what each person's job involves? So if we speak about picture A, so Abdelrahman, just can you answer this question about picture A?
Yes, doctor, just a minute. Okay.
What kind of job is does she represent? This picture, the woman in the picture. Okay.
Okay.
Picture.
Yeah, it's
receptionist. Okay.
Yeah.
Receptionist. Tala, what do you know about this job? Tala.
It's taking information from the patient and what the patient of risk is about the pain, and what is about the process of the patient, and take number phone and will it to date with to meet the doctor.
Exactly.
And what is the disease? Yes.
Okay, so about picture B, what kind of job is shown here, Ahmad?
That is the clinic, which is
B. Is it clinic, or where are the people in picture B, or at home? Clinic, at home, hospital. What is it?
Yeah, it is home, but yeah, I mean okay, it is health visitor.
Health visitor. So the person who visits people who can't move to the clinic. Yes, so a kind of doctor visiting the patients at home. Okay. Well, the next picture C is for Zaina, please. What is it?
General practitioner.
And his responsibilities, what are they?
They don't have just a specific profession, like they're just general.
But he has medical education and he can help the patients, right?
Yes.
And okay, and well, the last picture D here. If we listen to Sadin, what can you say about this picture and what is the job? Sadin, hello? The job is, the connection is bad. I can't hear you. No. So, midwife, yes, you are right. Okay, so we'll continue just discussion of medical jobs after the break. Takes care of newborns, right? You are. Well, let's just